The rapporteur, addressing to the chairs and my dear audience. Assalamu alaikum and good morning to everyone on this winter morning. I am Dr. Nurun Nahar chowdhury. Yes, thank you. Would like to present a case, an interesting case. I have found this case a few days back. This is an interesting case to me, a case of a conversion disorder, which could be a diagnostic dilemma too. A case of a young lady of 23 years old, graduate, married Muslim lady from a urban area, who have two daughters with her, staying with her law's house. Her husband was living abroad, work at Malaysia. She has complained of headache, convulsions, repeated fits for a prolonged time for last 2 years. And for this reason, she used to go to doctors, specialists, obviously other than the psychiatrist. She have visited the neurologist, neurosurgeon, so many physicians with these complaints, and have done many investigations like CT scan, MRI, and so on. But all the investigations and the diagnosis could not reveal any problem, whether she has medical problems or any psychiatric problem. Definitely she had a psychiatric problem. Then she was referred to me from a neurosurgeon, and then I have seen her. So you all know, as you are psychiatrists, and this is a platform for the Psychiatric Association, so you know what could be the diagnosis and what it could be. It is obviously, it seems a case of a conversion disorder. Now you all know what is the conversion disorder. From DSM-5, according to DSM-5, it is known as the functional neurological symptom disorder. You know that all the symptoms actually, in summary, these disorders have any physical problems. It usually are neurological symptoms, either any motor or sensory deficit, which couldn't reveal any medical conditions or any neurological conditions. So this unexplained symptom usually characterized in many physical illnesses due to psychological cause, and it must be a stressors or in conflicts in the mind. Usually these symptoms are lasting many days to years, and automatically sometimes it often relieved. Actually, this is obviously these symptoms at first it has a primary gain as it occurred in unconsciously, so it helps. Actually, it needs a professional help, especially from psychiatrists, and also it is treated by the psychotherapy if no hidden underlying comorbid condition is there. Now, one discussion from history and the mental state examinations, I have found stressors. It could be a stressors or in conflicts. The interesting thing is all the way she has presented with it, like headache, anorexia, nausea, dizziness, convulsions. She had 6 fits during these 2 years, which couldn't reveal any neurological deficits. Actually, she had done many CT scan, MRI in many corporate hospitals, which couldn't reveal anything. So, but from history, what I recovered that she had like stressors. Once when in childhood, she was hurt by her elder brother, according to her, and also the informant, which was her mother. All the time she was carried by her mother and aunt. No gents with them, no fellows, members from law's house, or no husbands, rather all. She was very sensitive. She was very sensitive, I mean, emotionally. So she, at that time, she get hurt, and it seems she get depressed because, according to them, she was totally quiet for a few days. Next, again, as she was an intelligent lady, and she was too much attentive to her study. She graduated Bangla honors from almost renowned college in rural area. She had a love affairs with a man, but it was totally forcefully forbidden by her mother, because her mother did not want to keep that relationship with that guy. After then, she get married, and after marriage, she didn't continue her educations longer, as her laws didn't want to continue it. So she stopped her education there. And during this time, she had, you see, she was a very young lady, and this time she get 2 sensitive episodes of emotional episodes of her brother, and also her love affairs. Then after being married with a guy by her mother's choice, who was living abroad, and during this time she had 2 daughters aged between 8 and 1.5 years. Now, last 2 years she has been through this trouble and going here and here over there, taking drugs, medicines, doing investigations, all this. She has, for the last 2 and 3 months, she used to stay away from her law's house for the schooling purpose of her elder daughter. So the most striking thing from my observation is, though she is presenting with conversion symptoms all these years, but I think it could be a mood disorders. So this is my dilemma, that this may turn into a depressive disorder. Actually, her mother has no insight. They did not want to see him by a psychiatrist. Actually, a neurosurgeon referred to me, as every doctor refuses her. So I have found that she might need insight-oriented psychotherapy, and also need antidepressant drugs too. But as her mother didn't want to visit with the psychiatry, they have no insight about the psychiatric illness, she was taken by her. So I have done only 1 session, and she was reassurance done, but I haven't get any space for next therapy, like explanation, advice, and so on. But I think if he visited, as he is living in Sripur, in our country, she might have gone to you or others, I think. So I have intended to tell you this case, that actually she may need help, and she may need the drugs too. So thank you all for your patience hearing. All these references I took from the books, the Oxford, the Kaplan. That's all. Thank you, and thank you for BAP also for giving me a floor on this first National Scientific Conference on Psychiatry. Thank you.